Good morning to those of us on the West Coast, and good afternoon to those of us on the East Coast. Welcome to our March 29th, 2016 webinar, Research-Based Strategies for Increasing Youth and Young Adult Engagement in Wraparound. I'm John Osowski, Project Manager for the National Wraparound Initiative, and I'd like to begin with a few housekeeping announcements. Please see the advice on this slide to make the most of your GoToMeeting experience. In particular, please note that during the presentation, all audience members will be muted, but you can send your questions to us via the chat feature. A recording of this webinar will be made available online shortly after the webinar ends, along with a list of resources that we'll be referring to in this webinar from the link shown below, and we'll have that link available on the end of the webinar as well. I'd like to invite everyone who registered for this webinar to stay in touch with the NWI by signing up for our monthly newsletter. We feature links to NWI resources like this webinar, as well as news and events of interest to the field. Announcements about the 2016 National Wraparound Implementation Academy, scheduled for September 2016, will also be included in the newsletter. You'll receive information via email after the webinar, and we hope that you will accept our invitation. You can also sign up on our homepage that's shown below at nwi.pdx.edu. Just scroll down and fill out the form. This webinar is brought to you by the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health, operated by the National Technical Assistance Network for Children's Behavioral Health, funded by Substance Abuse and Mental Health Services Administration, Center for Mental Health Services, Child, Adolescent, and Family Branch. We're very grateful to our partners for their funding and support. So I'd like to welcome you all to our webinar, Research-Based Strategies for Increasing Youth and Young Adult Engagement in Wraparound. And I'd like to introduce our webinar presenter for today, Dr. Janet Walker, who is the co-director of the National Wraparound Initiative. Janet is a research professor in the School of Social Work and the Regional Research Institute here at Portland State University. She's co-director of the National Wraparound Initiative and also director of the Research and Training Center for Pathways to Positive Futures, which undertakes research, training, dissemination, and technical assistance aimed at improving outcomes for older youth and young adults with serious mental health conditions. And with that, I will turn things over to Janet.
Well, thank you, John, and welcome everyone. I'm really pleased to be here with you today talking about one of my particular passions and very favorite topics, which is strategies for building youth and family engagement and empowerment in wraparound and across our systems of care. And of course, today we'll be focusing on youth and young adults, but we will have something to say about how that works with family engagement as well. So as we often do, I'd like to start with a poll. If you could show the first poll, please. What I'm curious about is in your wraparound program, so the wraparound program that you're the most familiar with, how much time is spent by wraparound core staff, and that means your care coordinators and your family or youth partners, engaging and supporting youth relative to their caregivers. So the first option is that caregivers get more of your core staff time on engagement and support. The second option is that it's about equal between caregivers and youth, getting about the same time, and this is across all of the phases of wraparound. And the third option is that young people get more investment of time from your core wraparound staff than caregivers do. So I'm going to leave that up there and give people a chance to vote. Hopefully there's voting going on. And I'm going to just go over the agenda in the meantime, then we'll look at the poll results. So what we're going to start out with is the question of why do we need to improve what we're doing with wraparound. And I'm going to talk a little bit about some research that I think provides a pretty strong rationale for why it is that we need to do something different and more intentional to more effectively engage youth and young adults. Then we're going to talk about research-derived practices for enhancing wraparound to increase youth and young adult participation. And then we're going to talk about testing the Achieve My Plan enhancement for wraparound, which is a package of best practices that were intended to increase engagement. Then we'll talk about our findings from the studies of the Achieve My Plan enhancement and what we learned. Then we'll talk about some upgrades and next steps that we made based on our learning from our studies and some preliminary evidence of how that's going. And we're going to finish up with what I call some take-home messages, what I think are encapsulate kind of the most important things that we're going to cover in today's webinar. So can we see the results now? Okay, so the biggest percentage there is getting about equal time, which is a nice thing to find. And actually this is very interesting. I guess I would have guessed that we would see more in the pink bar at the top because in a lot of programs that I go to, I find that there is more emphasis on caregiver engagement and support. So I'm happy to see that we do have a lot of programs where they're getting equal, and even a few where the young people are getting quite a substantial more investment than the caregivers. Okay, thanks. Next slide, please. So, as I mentioned, we're going to talk a little bit about the rationale for doing all of this work. Of course, voice and choice is the top principle of Wraparound, and it's not by accident that it's #1 on the list. Wraparound philosophy is very heavily rooted in the idea of youth and family voice and choice. And so what got us started in all of this was pretty much of an abundance of research showing that young people rarely participated in what we would think of as a meaningful way in multidisciplinary team-based planning for which included mental health. And we did a publication earlier. You can see the little picture of the cover there. And by the way, when we post the slides for today's webinar, there's also going to be a resource list with live links to every resource that we mentioned today. So this will be the first one on the list will be this one that you're seeing on your screen right now. So there's evidence, particularly a lot of evidence from schools in the IEP planning process. There's some from systems of care, and there's some from Wraparound in particular. I'm going to talk about that in more detail in just a second. We also found in our research that professionals were also dissatisfied with the level of youth and young adult participation in Wraparound and felt that they lacked strategies for increasing that and engaging young people more thoroughly. And I would have to say that my ongoing experiences consulting with individuals who contact the NWI and with my work that I do around the country certainly reinforces that there is room for improvement as far as engaging young people. Next, please. So as I mentioned, some of the relevant research that comes from Wraparound in particular, the original study that I was a part of that was published in 2005 was an observational study where we went around to, I think it was 11 states, and I think we observed almost 80 Wraparound team meetings and did a kind of a coding of what was going on and did some follow-up with participants. So what we found at that point was that young people were only 39% of the time present for more than half of the meeting. So that was anybody over the age of 9. And that came up to about 50% if youth were age 14 or older. However, we did find that young people, even if they were in the meetings, were rarely very engaged and not unfrequently completely disengaged. On our little post-meeting surveys that we did, we found that youth were more dissatisfied with Wraparound than other stakeholders. They were less comfortable in the meeting and perceived more team conflict. And providers on the feedback survey that we asked cited lack of youth involvement in the Wraparound team as one of the most frequently or the top worst aspects of the team meeting that we had just observed. So that was kind of for me what got me started along this line of research that I'm going to be describing a lot of different aspects to you today. A more recent study that we did, which included quite a lot more data. It actually had 3 studies that were included in this one publication. But some of the main findings from those different studies was that in general young people are less satisfied with Wraparound, and older youth are more dissatisfied than younger youth, so that dissatisfaction relative to other stakeholders increases over time. Youth rated their participation lower than caregivers who were in the same meetings did, so that lower than their own caregivers did. And there was some evidence of what I call crowding out of youth versus caregiver perspective, meaning that where caregivers felt they had a high level of participation, youth felt they had a lower level of participation and vice versa. And there was some evidence that this might increase with age. Now, the kind of study that we were doing, there could have been other factors that accounted for what we observed, but at least that remained our interpretation that that was possibly what was going on. Next, please. So what's to be gained here? I have a good friend who likes to say that choice is an evidence-based practice, and I feel that actually there is a very good reason for saying that. There is, again, this is an area where there is lots and lots of research evidence, not just from the mental health field, but including the mental health field and across a lot of other fields as well, that when people feel that they have a choice, they are much more likely to be engaged and happy about what they're doing, even if they're doing the same thing that they might have been compelled to do otherwise. So when people have choice, they're more interested in the chosen option, they have more excitement and confidence about what they're doing, and they're much more committed to act on an option that they feel that they have chosen. So when there's a plan and they've chosen what they're going to do, they feel much more committed. It's particularly for adolescents, when they choose the activities that they're going to be engaged on, they have more positive mood, higher well-being, and they also perform better. We also know that learning to make plans and achieve goals is an essential life skill, and this is probably particularly true for young people who are transitioning to adulthood, and I think particularly true for young people who have been in systems that are often very compliance-oriented and don't offer a lot of opportunities for young people to exercise and learn self-determination. So people who acquire a higher degree of self-efficacy and self-determination tend to be, as you can see here, more optimistic and hopeful, more persistent in the face of obstacles, they have better mental health, cope better, adopt healthy habits, and maintain behavior change. And this last bullet really refers to kind of some pretty strong evidence of when you teach young people, so if you do a randomized study and you teach young people who have, this is done with young people with disabilities of different kinds, you teach them more self-determination skills. The ones who have been taught self-determination skills do better on a bunch of different indices after high school than those who have not been taught the self-determination skills. So there does seem to be something of causation going on. Next, please. So if we think that wraparound could be enhanced, what are we talking about and what might the nature of that enhancement be? So what we're talking about, what we eventually decided on, was that there would be a structured process for incorporating a series of best practices into regular wraparound. So not essentially changing wraparound, although we'll talk about some tweaks later on when we get to the specifics of what we did when we implemented these best practices. But we wanted to make sure that we were increasing young people's voice and choice, both objectively and their experience of voice and choice, and that we would give them the opportunities through wraparound, or enhance their opportunities to really practice self-determination. So those skills around making goals and moving towards the goals. And so one of the things that we thought would be important on that, based on the research, our review of the research, was for them to come up with activities for the wraparound plan where they can take the lead. And that through the wraparound process, our team and people that were working with the young people would model, coach, and teach self-determination skills quite explicitly. Additionally, we thought it would be important to prepare the young person to collaborate most optimally with the team, because I think, as anybody who's been a part of a team knows, collaboration is not necessarily the easiest thing to do. So again, we weren't trying to change wraparound. I think everything you'll see that we were doing is very consistent with wraparound, but our goal was to have a more structured and intentional focus on what we think are the active ingredients that promote voice and choice and self-determination for young people. Next, please. So as we got started on this work, we wanted to do a research project that would develop and test an enhancement based on our best understanding of the research, and we wanted to see whether it was actually possible for us to increase youth participation, engagement, and so on in the planning process. And we got together an advisory board early on that included emerging adults, so we had young people who were currently in the system, who were kind of transitioning out of the system, etc., as well as caregivers, providers, and our research staff. And this advisory board chose the Achieve My Plan name for our collective collaborative work and developed the Amplify logo. I don't know, we have several different logos, but that's one of them that we have up at the top. And so our question was, what would be the characteristics of an enhancement, or what were some of the parameters that we had to think about if this was going to be a successful endeavor? So we thought, first of all, that it had to be feasible within the resources of agencies, and that essentially would have to be something that could be implemented with either no or very small additional resources beyond what agencies were already trying to do. We also thought that it needed to be something that was appealing, in that each of our sort of key stakeholder groups, so we have providers and caregivers and youth, would feel that it was something that they would support. So no, we wanted especially to deal with any issues of crowding out as far as caregivers were going, and for providers, making sure that it was something that was feasible as within the demands of their job. And we wanted to make sure that we were, of course, increasing engagement and participation in ways that are obvious and, of course, positive. So next, please. So the first thing that we did, and again, you can access this resource, you'll be able to access it from the resource sheet that we are developing to go along with this webinar. We reviewed the research to get best thinking about how we could achieve our goals and develop this enhancement, what would go into it as far as best practices. And we worked through what was available in the research, worked through it with our advisors, and did a bunch of testing, and then came up with the AMP curriculum. And I'm just going to tell you what, over the next few slides, just what the nature of the best practices are that we ended up incorporating into AMP, but these are best practices that could be used in, without doing AMP per se. We just wanted to make it easy by putting them together in a package. So sort of key areas that we think are important for supporting young people's increased engagement and participation include the organizational support, which is things like committing to some training, etc. Well, I'll go over each of these in more detail in a second. And then there would need to be a commitment to having someone work with the young person on preparation. What do they want to say in the meeting? How are they going to say it? What's their role, etc. Then some focus on making sure that there is strong facilitation during the meeting, so that the meeting that actually happens is the meeting that the young person prepared for. And then finally, that there would be some focus on accountability and follow-up, so that what happened during the meeting actually mattered as far as what the team was engaged with afterwards. Next, please. So preparation, this is one of our key points, that the young person knows what's going to happen at the meeting, how he or she is going to participate in the meeting, and that we don't want to have surprises, because surprises in the wraparound context, unfortunately, are usually bad things that happen during the week or the month before, that suddenly the team is thrown into crisis mode, and the original planned meeting can unfortunately often go out the window. Next. So here are some of the things that we have decided are kind of essential to ensuring that preparation is going to be optimal. We want to make sure that all of the agenda items are available to the young person so that they can review them prior to the meeting. That gives them a chance to do the second thing, which is to plan what they're going to say and to practice it before the meeting. Because we know that it's not easy, particularly if you feel a not experienced person or you feel somewhat nervous in a meeting, to just speak up. Even if someone says, hey, what do you want to say? If you haven't thought about it beforehand, sometimes it's not that easy just to spout it out. We think also that it's very important to have young people practice what we call pragmatic communication or constructive communication, which is how to say things in a way that is most likely for them to be received well by your people that you're collaborating with. We think it's also important to help the young person prepare strategies for staying calm and focused, not just because we expect them to be nervous during the meeting, but also because having a strategy helps you go into a meeting and not feel so nervous in the first place. And then also plan how a young person will get support if they need during the meeting. So if they are having trouble remembering what to say, or they feel like they need some help communicating with a certain person on the meeting, etc., that they feel they have backup during the meeting. Next, please. Then also, we feel like it's important that the young person has a sense that they actually control some aspects of the meeting. And one is, I kind of referred to this a little bit, we'll talk about it a little bit more in the future. They're going to contribute some small items, what we call activities, to the agenda. So these are things that actually originate from the young person. And that they ask for the team to support them in carrying them out. And then the other aspect is really the option to handle uncomfortable topics outside the meeting. So again, we have the agenda items, and I can just tell you an example. This was actually happened in a meeting that we saw where a young woman she actually didn't have access to the agenda items beforehand, but was suddenly confronted with the idea that everybody's going to be talking about her birth control methods during the meetings. So we tell young people that to consider the items, and I would say actually in our experience it's rare that we actually have this, but it's something that's comforting to young people to feel like they have choice. Next, please. So during the meeting, again, we expect that the meeting will unfold in a way that's very consistent with how Wraparound generally runs. A few changes in practice. We like to offer the opportunity for young people to individualize the ground rules, just so they feel like the ground rules express the conditions under which a young person will be comfortable. We expect, again, with the sort of no surprises mantra that we have, that for things that come up that aren't on the agenda will go into the parking lot, that they'll be dealt with at the end, that way they won't be hijacking the meeting content, and again, setting the stage for a meeting that the young person was not prepared for. And with our best practices, we want to actually begin the meeting with the activities related to the goals that originate with the young person. So in our actual practice, this is about 5 minutes of just talking and reviewing with the young person activities that they have placed on the agenda. I would say a very typical type of activity might be finding out more about a certain career or something like that, or going to visit the high school that they'll be in after they change placements, or something along those lines. And so there'll be a checkup on how that one went, and perhaps a little bit of discussion on what will be the activity for next time. And again, we like to have this happen at the beginning of the meeting to show that we are respectful of what the young person is doing for their own lives. Then we also expect that there will be strong facilitation during the meeting, so that there will be specific facilitation practices that think about enhancing collaboration between the team and the young person, providing multiple and enhanced opportunities for participation for the young person. Again, we feel like there has to be a fair amount of intentionality behind encouraging the young person to participate and making it comfortable, because otherwise they're not just going to pipe up and interrupt other people, or even sometimes talk when invited, so that there has to be a little bit more effort placed there. That the facilitator will know how to interrupt dynamics that undercut respect or participation. So that can, I would say most typically takes the form of somebody lecturing the young person about how they should be doing things differently in their lives. Keep the meeting focused and efficient. Nobody likes a meeting that wanders all over the place, but young people in particular can get bored pretty quickly. And then, of course, ensuring who's going to do what in the follow-up. Next, please. And again, a couple of resources that might be handy if you're interested in finding out a little bit more about these things. So we have a version for facilitators. This is based on our research and our advisory members, things that young people hate most when they happen in meetings, and things that facilitators can do when they recognize these dynamics getting going. Then the one on the right is tips for young people about how to prepare for active and collaborative participation in team meeting. Next, please. So the final area we had for our sort of 4 major topics of how to ensure better participation is to make sure, as I mentioned before, that once things happen and you have all your youth input in the meeting, that then the follow-up is based on what was decided in the meeting, and including, of course, things that were decided by the youth or with active youth input. So obviously it's important to record the decisions, and as we'll talk about later, after the meeting in booster sessions, or whoever is working with the young person, they can follow up and see who's doing what and plan for subsequent team meetings. And this also, that the young person has a record of who's doing what for the plan and an access to copy of the plan. And then finally, that there should be some assessment of the extent to which the sort of youth engagement supportive activities actually happen. So there's some fidelity to the steps of preparation that were planned to help the youth participate better. Did those actually happen? And were meeting structures and procedures followed? Like, did we actually use the parking lot for agenda items that weren't on the original agenda, or for crises? Did we manage those by doing them at the end of the meeting rather than taking the whole meeting to manage a crisis? Also, it's helpful to look at satisfaction from team members and from youth in particular. That can be qualitative or quantitative data, and to also look at some meeting outcomes about assessing whether stakeholders feel that the young person is participating and whether the young person feels they have growing self-determination or empowerment. Next, please. So just briefly, also the organizational support, I put this at the end of the slides. Obviously, if you're going to do some of this stuff, there needs to be practical support from the organization. So there needs to be a focus on spending some of that organizational time and the time of your care coordinators or your youth and family partners to prepare the youth. And those people need to be trained on how to work with young people and to undertake those best practices, or at least an assortment of best practices, if not all of them, to prepare the young person for the meeting and to encourage their participation. So some of that will require some changes to structures and policies. So for example, we work with organizations with AMP, get all the agenda items in a week beforehand is something that sometimes people find a departure from their current policies. So there's that. There's certain things like, for example, encouraging the young person at the start of the meeting to take 5 minutes to report on their activities is also usually not a part of standard wraparound practice. And then, of course, there needs to be some organizational follow-through to make sure that people are actually doing these things, and that the ability of staff to promote youth participation and engagement as part of their supervision and their evaluation. And then more broadly, it's helpful to see when the organization is helping to drive more youth and young adult voice and choice throughout the system of care. Because, for example, we have providers that come in from child welfare or from a mental health agency, et cetera, that are coming into wraparound team meetings. Part of the work to make wraparound youth voice and choice friendly is to help get those participating providers on board with the general outlook of encouraging young people's empowerment when those providers are working with them as well. And then also helping to work with families to understand youth voice, and to understand that pursuing youth voice does not mean in any way or in any respect reducing the extent to which we're concerned with family voice and choice as well. Okay, so I think right now we're going to move to poll number 2, which is asking about this as one of the aspects of organizational support. So again, thinking about the providers that work with your wraparound program. So these would be the mental health providers, child welfare caseworkers, if you have probation officers, etc. And I know that's a very diverse group, but just in general, how focused on youth voice and choice do you think they are? So one of the top choices across our system of care, this is a pretty high priority. People are mostly really concerned with and actually do things to promote youth voice and choice, youth and young adult voice and choice. The second one is sort of, it varies a lot by agency or system. We have some that are really sort of progressive on this and maybe some that haven't really done much. And then finally, maybe there's some individuals who are very into this, but the organizations and agencies, they're really, as a rule, it's not a priority of the provider organizations. So I'm just going to give people a second to vote on that, maybe 10 more seconds to vote, and then we'll look at the findings, the results from the poll. And I am going to put myself on pause here and just take a sip of water. Okay. Perfect timing. So encouraging to see that close to 15% of providers across, so that looks like people who are working in systems of care that really put in a lot of thought and are pretty consistently trying to implement youth voice and choice. 55, so just a little over half, says, I mean, basically that there are kind of hot spots of places within the agency or system where people are really doing intentional and systematic job of trying to promote youth and young adult voice and choice. And 31% where, unfortunately, that's almost a third, where people are working in systems of care where the providers are pretty much not making any kind of organization or agency-wide effort in that direction. Again, very interesting. And we do, by the way, post the results of these polls as well. So if you're curious about them or want to remember, those are archived along with the rest of the webinar information and the resource guide. Okay, great. Next, please. So just a quick summary of what our idea is about how this will work. So we've already kind of discussed the need for training and coaching and organizational support in order to see best practices happening in the 3 areas that I mentioned. So when this happens, this is what we think, that young people, that there will indeed be, and that young people and other stakeholders will perceive that there's increased choice for the young person, opportunities to practice self-determination and skills, the related skills, and that young people will also feel they're more aligned with the team because the collaboration is enhanced through those communication strategies that we discussed and the enhanced facilitation, etc. So as a result of that, what we expect to see is that services and support actually work better because we have young people feeling like they have more choice about what services and supports to get and how to work with providers around optimizing services and supports to meet their needs. We also believe that young people will experience that success in planning and positive coping that's part of acquiring and practicing self-determination skills, and that they will make progress on the goals that they set out, those ones that are attached to their own activities and priorities, which in turn, next please, will lead to the outcomes that we hope to see from Wraparound, including increased self-determination skills and self-efficacy on the part of young people and empowerment, but of course their improved functioning and the goals of the Wraparound team and the young person themselves being achieved. Next please. So again, just to mention that what we did was we put these best practices together into the Achieve My Plan intervention. So we packaged it up so that it would be relatively easy, and we put together all of the worksheets and expectations and kind of, you'll see a little bit more detail on what is in the intervention in a sec. We did an original pilot study that had pre-post measures and showed substantial improvements in engagement and participation and increased satisfaction from all the stakeholders. So we did not see any evidence of crowding out that I described before, so that made us very happy. And then we took what we learned from that and implemented a randomized study within 3 wraparound programs in 3 counties in and around Portland, Oregon. And I'm going to report on those findings in some detail. They're fairly new findings. We have finished the study now. And we are just to say that we started with this with our randomized study. We had what we called AMP coaches. We took university interns. Some were undergraduate, some were graduate. Some had significant experience in the foster care and mental health system, and some did not. We just didn't have the ability to have everyone be a peer, but we were kind of looking for people who were willing to be peers because we were exploring that as part of our option. And we trained them for about 6 weeks, so pretty quickly, I feel like. And we had multiple types of assessments, which I will describe in some detail as we go through this. Next, please. So the intervention, I know there's a lot on this slide. Again, if you're curious about, take a look at, you can download the slides and look at it in more detail. But basically what we did for AMP is had 3 meetings prior to the first, what we called the AMP team meeting. So the sort of kickoff of what we thought was the enhancement for youth and young adult participation in their team meeting. And so those were 3 meetings with our coach. And in the first aspect of the team meeting, actually these could be and often were done in 2 meetings, but we have them sort of conceptually divided up into 3 meetings. Essentially in the first meeting there's some sort of big dreaming about where you want to go into your future, and then kind of talking about strengths and capacities. And then based on all of that, we kind of narrowed it down to some activities that the young person wants to put on the agenda to have the team support him or her in doing. And those were those things I mentioned before, like finding out more about a career option, for example, visiting a school, signing up for some kind of class or lesson, etc. I mean, a lot of different things, but those are some of the more typical ones. So in the second meeting is when the agenda items, or when the young person does identifying more about their support and refining what they're going to say on their topics. The third meeting, which is the one obviously closest to the actual wraparound team meeting, they review, there's a review of ground rules. As we said there, I mentioned in AMP, we like to do some individualization of the ground rules, so the young person actually presents those during the team meeting. Review the agenda items that are from other people. What are we going to say? Young person puts together usually some kind of materials to support them, so flashcards, notes, however it is that they want to do them. The coach works with them to prepare those. They talk about that, what we call the pragmatic communication or collaboration, and prepare a plan, as I mentioned, for how to get support during the team meeting if somebody starts to feel nervous or can't say what they want to say or forgets, etc. So then you go around, you have the team meeting, and use those best practices that we talked about. And then essentially after that, you can see the hexagon that's there says repeat the main steps of the process for future team meetings, but there aren't 3 meetings every time after that. For AMP, we basically have either 1 or 2 what we call boosters between the meetings that are check-ins, essentially, to sort of review what's going on and to prepare for the next meeting. And those can be done by phone or in person. They can be integrated into regular other check-ins or whatever else is going on. So we feel like at that point, so in our process, our coaches worked through those first 3 prep meetings, and then there was what we call the handoff in our intervention test to the care coordinator on the team. And so it was the care coordinator who was doing those boosters afterwards. So that was the state of AMP that we used in the intervention. As I mentioned, it was a randomized study, so we had care coordinators were randomly assigned, so not youth were assigned randomly to the care coordinators, but a care coordinator was either in the intervention or the control. We did various types of assessment, including telephone and online survey. So the youth all got telephone or in-person, actually they often got in-person surveys. The care coordinators did the surveys online, and the caregivers had the choice of doing them either in-person, phone, or online. We had everybody filled out a post-meeting evaluation, just a little sheet after each of the target meetings that we assessed. And at the first team meeting, we also did a video that we coded to see how much was the young person actually participating. Next, please. So, well, this is just showing kind of the key constructs that we were looking at. So we were interested in, did the youth actually participate? Did people, including the youth, him or herself, feel that they were participating? What was the nature of the alliance with the team? We used a working alliance inventory, which is very famous from work with all sorts of psychotherapies and is very predictive of outcomes. We adapted it for the team. We looked at some mental health functioning. We looked at empowerment and, again, satisfaction by all stakeholders with the meeting. You can probably press this a couple times. There's animation here, but just to, I think there's one more. Yeah. Okay, so this is a little complicated, again, the timeline, but essentially we consented people into the study and collected a set of data before we did any AMP at all. And of course, youth in the control setting didn't get AMP. But we, so then we did there was what we call the target team meeting. So that was the first team meeting that young people were prepared. The ones in the intervention condition did AMP before the target team meeting. And then there was a post-meeting survey after that meeting, and we did our time to assessment within a week of the target team. Then we had meetings 2 and 3 where we also had post-meeting surveys from all participants, and then after the third meeting we did time 3 for the online or in-person interview assessments. Again, a little complicated, but I encourage you, if you're interested in taking a little more time with this slide, download the slides and check them out. So we had a total of 55 participants, so this is not a large study. We were shooting for 60, but our ability to continue recruiting, we just had to stop after a certain amount of time. You can see there the breakdown of participants that we had. Next, please. So again, this is kind of a complicated slide, but this was based on our coding. So we did a very elaborate and coding approach with lots of reliability checks, et cetera, to make sure that we were being objective in what we were seeing. And basically those are percentages that you see in control versus intervention of things that we, in the 1-minute segments, what did we see? And you see that the top and the bottom rows, one is task orientation and one process advocacy. Those are things that really relate to the team meeting, the team as a whole being on task, because one of the things that emerged, we thought kind of surprisingly, from our pre-post test was that the teams were much better organized and on task in the AMP meetings than they were in the meetings that didn't have AMP. And we attributed that to the increased attention to the agenda and the agenda preparation and the agenda form that we used for AMP. So we wanted to see if that was actually true. And it turned out that it was true at the T, you see there, at the trend level of significance for task orientation, and significant for what we call process advocacy, so the extent to which team members are collaboratively guiding the team in its work, that was actually significant. So that was a very interesting finding. Again, we're talking about a pretty small sample here, so the fact that we're finding things means that they were very pronounced. And so you see the things that have sort of multiple stars were the things that were the most significant. Anything with a star behind it is statistically significant. And just generally, every aspect that we looked at was in favor of the intervention, although not all of them were significant. But we did see the young people were leading more often, like speaking for whole minutes at a time. It could have been multiple minutes in a row, that they were speaking significantly more frequently in the intervention, that there was generally more positive interaction between the youth and the team, that the team was inviting the young person to participate in a we call high-level contribution, which means something more than answering a question yes or no. and you can see that's very significant. And the team agreeing to act on a youth's idea, which pretty much only happened in our intervention condition. Perhaps that's very reasonable given that we have the young people presenting their ideas more. And that's a focus of the AMP preparation. Next, please. So here we're looking at the post-meeting surveys, and we are, though again, these are 3, and these happened after meeting 1, 2, and 3. And we had 2 scales that we formed out of the items. One was the perceptions of youth participation. So this is each person who was at the team was responding to items like youth had multiple opportunities to present their ideas, participating meaningfully in the discussion, etc. And there were 9 items on that scale with good internal reliability. And the other scale, as we mentioned, was the getting things done scale, which, as I have said before, we found that people using AMP actually tended to have more efficient meetings. And again, this was a 3-item scale with items like we stuck to the agenda and got important planning done, etc. And 3 items also decent reliability for that scale. Next. Just really quickly for the post-meeting surveys, you could break this out in a lot of different ways, but you can see the numbers of people at meeting 1, 2, and 3. We had pretty high numbers on the post-meeting survey, and then by role, this is the average across the different meetings. So, for example, there was an average of 33 youth for each time point, and you can see, obviously, if you add up all the rest of the people, there are a lot more of them in the meeting. Next, please. So this is a sort of an example of the type of finding that we had, and you can see the intervention line is above, so we had a 4-point scale. Well, we had multiple items, but the means were on all the items were on a 4-point scale, and the mean was on a 4-point scale. Essentially what we're seeing here is that in the intervention condition, and we're looking just at all respondents. I could show you each of the respondents separately. I have a summary in a minute. But this is very typical for what we saw, that the intervention was rated higher in this case. This was youth participation, so everybody thought that young people were participating more, and this was highly significant. And that the effect kind of went downhill over time. And this is something that we became very aware of and are quite convinced had to do with our implementation of an intervention where we had our coaches working with the young people and then that handoff to the care coordinators, and our feeling that the care coordinators were really not understanding AMP that well, even though because we never actually trained them in a really intensive way about AMP. So you'll see that was one of our primary lessons learned, something that we changed later on. Nevertheless, we were very happy that AMP did seem to be having an impact. Oh, go ahead, you can do the next one. Getting things done also significantly in favor of the intervention for main effect, and not falling off so much, although not so obvious of a difference by the time we're getting to meeting 3, but still significant. Next. And then finally, this was a single item that we had about everybody's overall satisfaction for the meetings. Again, in favor of the intervention, and in our assessments, we saw no evidence of crowding out. So all stakeholders were happier with AMP. When we looked at it by stakeholder separately, we didn't see that caregivers feeling, for example, that they were less satisfied with the meetings, etc. Next, please. I'm going to go over these kind of quickly, but these had to do with our interview assessments. So if you're looking between time 1 and time 2 and time 1 and time 3, we found significant impacts from our youth participation and planning scale for preparation. Not surprisingly, AMP is all about preparation. Also, and this is again from all stakeholders, significant effect for the intervention on the youth participation in planning, which we saw in the post-meeting surveys as well, obviously, and in the video data. And since that was one of our main focuses, we were happy that these different sources of data were confirming one another. What we also saw in the preparation was that beyond other stakeholders, the youth, there was an additional bump from youth saying that they had preparation. So the difference between the intervention and control was even more pronounced for young people. Again, not surprisingly, because they actually participated in the preparation. The SFSS, which was our internalizing and externalizing mental health outcomes, I'm actually surprised we saw a trend level impact at all. A trend level is not statistically significant. It just sort of going in the right direction, and considering that this was a relatively short-term intervention, and also that obviously it's Wraparound, there's lots of stuff going on, not just with the Wraparound team, but these are young people who have very eventful lives. You know, to see even the possibility of some kind of impact there, to us, was very exciting, and something that we're going to look at if in the next iteration of AMP, when we do something with a little bit more what we call dose, or a little bit more longer intervention. So next, please. So here's again a kind of another representative graph showing control versus intervention. Now remember, at time 1 nobody had the intervention, so we see the points just like we would expect between the control and the intervention starting at almost exactly the same place, and then bumping up at time 2 for the young people. That would be between, you know, after the first meeting, and tailing off again. We think part of that handoff issue, and also perhaps that AMP, the booster sessions, don't have the same level of preparation, but still significant for the intervention. Next, please. So finally, we had some youth-only measures. These are measures because we only had youth. We had a much smaller sample to deal with. So again, we had non-significant differences in empowerment that all favored the intervention group, but we saw by time 3 a significant improvement in the alliance, which was again something that we found very encouraging. Next, please. So by the way, the blanks just mean there was a non-significant finding there. Hopefully that doesn't confuse people too much. So what did we learn from all of this? Well, we think there's pretty strong evidence, again, from our multiple types of data and our multiple respondents, that AMP can have a significant impact on youth engagement and participation, and that young people in particular found the impacts very positive and pronounced. We feel that it's pretty good evidence that it's not a zero-sum approach, or that there's, in other words, there's not that crowding out that we had potentially seen in some of the early Wraparound data, that everybody was happy to see the young people participating. In fact, in our qualitative comments, lots of people very, very pleased to see the young person actively engaged in the Wraparound team meeting. We did, we think, very clearly see that there was a difficulty in our strategy of having the coaches being from outside, being from our university, and then handing off to the care coordinators. This is something we have changed, and I'll talk about that in a minute. And that we also think that even perhaps what we call a higher dose, or a more, either a longer intervention extended over a longer period of time, that perhaps we would see an impact on mental health status for our young people. So we finished up this study probably, well, we were learning as we went, but we finished it up almost a year ago. And since then, we have been integrating what we call some upgrades into our future work with AMP. One of the things that we have decided is really important is that when we're working with both our new versions of AMP, one that works with care coordinators and one that is designed to be implemented by peer support providers, by youth and young adults who are doing peer support to youth in Wraparound, that we need to do additional coaching with them around having what we call youth-driven conversations. And this is something I've become extremely interested in lately, mostly because I've been watching a lot of video of practice with youth and young adults, and noting that really a lot of people don't necessarily seem to have the skills for really drawing out authentic perspectives from young people, versus kind of giving a lot of advice, suggestions, etc. What we would typically think of as a youth or young adult driven conversation. So we have decided that we need in our future training to make sure that people have that level of very basic skill, so that they're not just doing the best practices, but they're doing the best practices in a modality that is really about these, letting the conversation be structured and driven through content from the youth or young person. So as I mentioned before, we now have kind of upgraded our original AMP, and we're having it be implemented by care coordinators. So we have a couple projects going right now where we're working with training and evaluating our AMP project with care coordinators. And then the other version that we have is, again, the AMP Plus that we call, which is implemented by youth or young adult peer support providers. And because it's an AMP, in the AMP, we call it the AMP family now. Because it's in the AMP family, it's designed to work with Wraparound, but it's also intended to be something that, a structured process that peer support providers can use with young people, even if they're not doing Wraparound. So if they're doing a program that's TIP or drop-in center or whatever, they can still use our AMP Plus. Next, please. So just a little bit about these skills for youth-driven conversation. As I mentioned, I mean, having watched a lot of video, I think I was kind of hit over the head by the need to really focus in on this area. We know that roles for Wraparound are extremely difficult, and I would say that certainly within the NWI and maybe more broadly in our field, we've really focused a lot on the skills for the team meetings and less for how to really ensure that those important conversations that go into particularly preparing young people and families to participate in the meetings, really much less attention on that aspect of Wraparound practice. Again, we know that that's the top Wraparound principle, but there is not a lot of clarity about how to judge this in practice. And as I mentioned, I've been involved in a lot of review of video material, and so we here in my research team has been thinking a lot about how can we provide reliable feedback based on reliable ratings of how well people are doing as far as youth and family driven conversation. And I want to just describe briefly, next please, a little mini study that we did with the Wraparound, with the National Wraparound Initiative, because of our emerging awareness of this as a challenge for Wraparound. So we got, and thank you to anybody who may have participated in this, we had people submit to us meetings, actual footage of one-on-one meetings that were connected to Wraparound, and we had permission from everyone to share these for research and training purposes. And we had our experts. Now these were our experts, NWI advisors, so these are trainers, supervisors, coaches, and highly experienced facilitators participate in this rating process. And we just wanted to see how they would rate representative practice in terms of how youth and family driven it is, and actually we also had them look at it in terms of strengths-based. So we had these approximately 20-minute videos, and we had people look at them in segments of 1 minute, and we asked them for each segment to just comment on, do you see good practice going on, and how would you describe that? So what do you see that's going on, say, is particular youth and family driven? I mean, it was either, there was one video that was a young person and one that was a family, one-on-one conversation. Did you see something good? How would you describe it? And did you see something that we called improvables that could have been done better, and what do you think that was? So we did not try to dictate or tell people what to look for. We wanted to see, given that this is such a cornerstone of practice, would people agree? Would they agree on the rating of what was good and not so good? And would they kind of agree about what the practice hallmarks are? What are we looking at that tells us whether it's good or not so good? And at the end of the video, they rated the entire thing on a scale of 1 to 4, sort of all the way from beginning practice to very skilled practice. Next slide, please. What actually was kind of a big surprise to me, we did not see a lot of agreement. And you can see here we have 2 videos. We have a 4-point scale. People used every point of the scale on each of the videos. We did see more people rating video 2 higher kind of than video 1, but we did not see a real convergence around a particular rating. Also, when we looked at the when we looked at the actual comments that people were providing, it was quite obvious that people were not using the same terminology. They might have been picking up on some of the same things, but it was not super consistent. And when we looked at what we called the improvables, or things that people could have been doing better, we did find that people had a lot harder time identifying specific things to be improved. So they were better at picking up on what was going right, not so good at picking up on improvables. So that kind of reaffirmed our feeling of what we thought was a need to do some additional focus on that when in our future training and coaching. And just by the way, we also are working on modules through the NWI that'll be available probably later this year, where everybody can go through and do a little practice. We call them booster training, a little brush up on recognizing, looking at videos and recognizing family and youth-driven practice. So that was a little digression, but just really interesting to me and explains what I think of as our increased focus on the need to really look at practice, not just check off that we're doing certain activities. Next, please. So what we stress when we talk about family and youth, this is just a really quick little overview, is a balance between guiding and leading. So we call that guide without leading, which means that when you're having a conversation with another person and it's driven by their perspectives, or supposed to be, you have a delicate balancing act where you need to guide the process so that it unfolds in a specific and kind of structured way and gets to accomplishes the purpose. There should be a purpose to the conversation, but you don't want to supply the content, so you can't guide, you can't lead. You have to guide without leading. And as we can see here, it's something that takes a fair amount of skill. Next, please. So in the person who's coaching, so if this is the care coordinator or a peer partner, that their goal and role is to provide a strong facilitation of the process, but again, and focus on, well, in our case of AMP, increasing self-determination skills and having experience where they can deploy those skills. So that's the guiding. I mean, we have a strong goal, very intentional focus on what we think are the active ingredients. So that's the part of guiding, is to make sure that those active ingredients are activated in our conversations. So next slide, please. The other part that we think, though, is the without leading part. Again, how do you facilitate a conversation that ensures that the young adult's ideas are the ones that are emerging, and making sure that the young person is learning how to access and connect with the things that motivate them and the things that they're really interested in. So again, we're really interested in promoting that balancing act, so that without leading, there's this eliciting process, but also framing and reframing, and helping, again, construct experiences that help young people experience self-determined activity. Next, please. So we have, as I mentioned, upgraded. We have new AMP and we have AMP Plus. So as again with the regular AMP, we have the care coordinator. With AMP Plus, we have the youth peer partner. Therefore, we think we're avoiding that handoff problem and have a higher dose, because a care coordinator obviously is involved with the young person over a longer period of time, as is most typically a youth peer partner who's working with a young person in Wraparound. We have training that's really focused on those skills and consistent with research best practice. And part of our goal here was to avoid what we call the training transfer problems, where you send someone away for a week of training and they come back, and what research tells us about the extent to which they implement what they've learned is zero in the absence of any ongoing coaching and support for practice change. So what research tells us is the way to learn is more like you do if you were taking piano lessons. You learn something new, you practice it, you get some reliable feedback, and you go through learning and advancing. And we think that the way to do this is by what we call remote training and coaching, where rather than spending all of our resources on 1 week of intensive training, that we do this sort of more class type, or think of it as maybe a college class or something, learning where we are interacting via the web, but with people over a longer period of time in a more focused learning process. Next, please. So just real quickly, we use webinars to present new information, web conferences, and then we have this web-based process that we use for providing feedback, again focused around the extent to which a person who's doing AMP, and again it could be care coordinator or peer, is using our best practices and interacting with the young person in that youth and family and strengths driven way. So we have very specific markers for what we're looking for, and we prepare reports and give feedback, including video clip review to our trainees, and we're very pleased actually with this approach for skill building. Next, please. One of our current AMP projects is a statewide implementation in Massachusetts, and we are there, again this is normal AMP, so we're training experienced care coordinators. So these are all people who have worked with young people before, and in fact are in agencies, the early cohorts that we're working with are in agencies that have a particular commitment to empowering young people and engaging them. And we use self-assessment that we have developed for their skills and competencies for working with young people and preparing them for wraparound. And that's the form that you see over on the right. We also rate their videos, and we've seen very large, both of these sources of data have shown substantial improvements, even though, again, we have a fairly small sample. So we're seeing what we think are pretty dramatic improvements, and that's both by our assessment and by the care coordinator's own self-assessment, despite the fact that these are people who are already very experienced with wraparound and committed to Youth Voice. So we're very pleased, and apparently our trainees are as well, because our satisfaction with training is very high. So anyway, that's the approach that we're using now. And next, please. Take-home messages. These are, I think, the key things. If you only have to remember a few things of our training to transfer to your knowledge base. So one is try to use some of those best practices. You can find them in the publications. I think particularly preparation, super important. And again, it's not just going through the steps of helping a young person prepare for the meeting, but additionally that it needs to be through a process that really is youth-driven conversation, getting their ideas out, helping them understand what motivates them, and not trying to talk them into what's going to be best for them, or etc. And I should mention that we place a premium in these cases on, yes, being pragmatic, what will the team support, what will your family support, but it has to originate with the interests of the young person. Again, have the meeting the young person is prepared for. Don't let crisis of the week hijack the meeting. Otherwise, we'll always be in reactivity mode and we'll never get proactive planning done. The young person won't get to experience that self-determined planning and activity. And again, during the meeting, focus on the planning. This is certainly one way to keep the meeting short. Because one thing that we have seen in meetings, we see things like venting, we see the attempts to deliver therapy, we see a lot, unfortunately, of lecturing the young person of how they should be acting differently in their life. Ensure that there is a follow-up, as we mentioned. Develop and coach provider skills for having those youth and family-driven conversations. It turns out it's really just not that easy. And collect some data to see how you're doing. I recommend, at the very least, those post-meeting surveys. You don't have to do them all the time, but maybe set aside a month and collect some data from your teams to see how are you doing. They're pretty easy to analyze. So I think that brings us, oh, well, we do also have one more resource. You can get this, something that we developed at Pathways. This is our assessment. We now have a Spanish version as well. That packet includes the Youth Empowerment Scale Mental Health as well as the Youth Participation in Planning Scale. So you can get both of those. In addition, there's a citation for the article that describes our scale development work. Next. Okay. So I'd like to, again, thank you for being here. I think we'll probably take some questions. I'm not quite sure what time we were supposed to finish, but we have some time here. And if you're at all interested in more information about AMP and or AMP Plus, feel free to get in touch with me. That's my email. And just again, in case you didn't hear it or joined us late, the slides and resources, I would say within a couple hours, excuse me, will probably be available up on our website, and also the poll results will be up there as well. So, John, are you going to facilitate the questions now?
Yes, I'd be glad to. One of the questions that came in and was sort of touched upon during the webinar, but I think deserves a closer look too. So the questioner is asking, when the caregiver's choice conflicts with the youth's choice, how is this managed through AMP, and does the caregiver or family choice trump the youth's choice?
Mm-hmm. Well, I mean, I think the part of this is a very complex question because there's lots of different issues and aspects that come up. I think that it is a common, let me say, fear, I think, from people that, oh, if we empower the youth, they're going to start just making all the choices, and that's not really how we think it's going to work. We do want to have areas where the young person is making some choices, and that's why we really focus on having those activities and things that the young person is really kind of in control of. And we vet those very carefully, so there's a whole process for that. Again, we're focused on being pragmatic. I think just like any other collaborative group, people who are really working in a collaboration know that no single person is necessarily going to have the decision. But there's another big body of research that shows that people who feel like they got a fair hearing are, again, more committed to the decision than people who feel like they were just run over in the process. So what we really want to do is we prepare the young person. I mean, I think they know that they're not probably going to get a favorable reception to certain things that they could propose. So part of AMP, and that's again why I said, I think in the last slide I said preparation is key. I feel like the good preparation, thinking about being pragmatic, how is your team going to receive this, how might you say this the best way, goes a long way to averting those kind of problems where when there's no preparation and you ask the young person, what would you like to do, and they're like, I want to drop out of school tomorrow. Well, of course that's going to start something right away. So, I feel like having a meeting, thinking about it in that cool preparation type of way, and then controlling the meeting so everybody is interacting in that way is the best way for forestalling those kind of things. I think young people know they're not going to get their way on every single thing, and that's not what collaboration is. And I do want to emphasize when I say having a youth-driven conversation is kind of a different thing from saying that Wraparound is all about being driven by the youth. That's not what I'm trying to say. I'm trying to say that the part of getting the ideas out has to be emerging from the young person's perspective. Then those ideas get tossed into the collaboration mix. I do think sometimes people shut down young people's ideas out of fear that they're going somewhere bad when really they're not. So again, I feel like there's just a lot of room for productive stuff that isn't exploited effectively, and ends up with sort of a lot of shutting down and quashing because of lack of strategic and thorough preparation, mostly of the young person, also of the family, and then good facilitation during the meeting.
Great. Speaking of preparation, this question I think speaks to, during the webinar we talked a lot about how young people are prepared and to engage with their teams, and this question is about how providers and families are prepared to work with the person. So,
to work productively on wraparound teams. This is a part that we have only focused on kind of more informally, and something that I really want to work on, we have some collaborations with Youth Move National, is on how to, some best practices for providers who work with young people to do kind of mental health therapy and other services in a youth, a more empowerment-oriented way, because I feel like a lot of, you can work on this a lot with your core people, and then as we saw in that second poll, here you have 33% of people that feel basically like they're working with a lot of system partners who don't have this approach. So obviously there's a lot of work that needs to be done there, and that's something that we do hope to focus on. Working with family members, again, with Youth Move, we've sort of started thinking about a curriculum for family partners. Not every site works with family partners. We do feel like when we're doing traditional AMP and are working with the care coordinators, that goes a long way towards the care coordinators understanding and being able to communicate that with the family. So we feel like we're kind of getting a twofer with the training that we do in the care coordinators under those circumstances.
The next question sort of relates, I believe, to when AMP is being implemented. So is AMP implemented, when the wraparound staff have already met with the caregivers and gathered information and started to gain trust in a relationship with the family, or about when would AMP be a good time to implement?
Right. Well, this is also an interesting question. So with our intervention, we didn't really have control over that. So we actually, and we kind of had to work with our organization. So we actually brought in AMP after the team was established. And typically we tried to bring in AMP pretty close to the beginning of teamwork. My own personal feeling is that AMP could start as soon as a young person gets involved with wraparound. It's when we do it right, it's not threatening, it doesn't detract from the team, and why not have the young person's engagement maximized as early as possible. And that's what we're working with in Massachusetts. But of course, as you train people, what happens in the real world is you train people and then they start doing it, and some of their young people are just coming in and some of their young people have been in wraparound, etc. So what we would like to see and what we have done in the past does not always match up exactly.
Great. And I think we may have time for one or two more. This one's regarding the 3 meetings that happen with the young person before their team meetings. Is the person who coaches the young person, is that also the person who would coach the staff on following AMP?
Who coaches the staff on following AMP, did you say?
Yes.
Well, again, this is an area where what we did in our randomized study is not what we're doing anymore. So as I mentioned, for the randomized study, our coaches were university interns, so these were young people, not a whole lot older than our AMP participants. So they were doing, I'm sorry, the last person was, so it was who's doing the coaching and then what was the last part of the question?
So that person who does the coaching of the young person, is that the same person who would also coach the team on?
Well, so in the case of the care coordinator, and I guess we don't have maybe coaching quite to the same extent with the team. I mean, obviously somebody has to explain what's going on. I think that's why we feel that working with the care coordinators in regular AMP is it seems to be going a lot more easily because they really understand it. They can explain it to the team and they can continue to help the team understand what's going on. I think we also have a piece of our training that's based on those really colorful, I don't know if you remember them, there were sort of those orange and yellow tip sheets where we work with facilitators. We have some very nice video from our pre-post AMP study showing things that can go horribly wrong in team meetings and suggesting how you recognize some of the key things that go wrong and how to interrupt those in a gentle, respectful way, but make sure that they don't just develop into these types of things that young people completely turn off from wraparound when they encounter them. So in those cases we have training for the care coordinators because typically they are also the people who facilitate the team and the team meeting. And then again, as I mentioned in answer to the last question, they're also people who can help families understand what AMP is and what it's not, so that they don't have to worry that now wraparound is just going to somehow start facilitating any whim that their young person might have. So, which is not, I mean, it's not an unreasonable, and it's certainly a common fear that people have. So with AMP Plus, our focus is on working with supervisors who in the wraparound organizations to basically figure out those issues, how it's going to work in their organizations, and support the young people who are doing peer support, so that to make sure that they're not coming into a kind of a hostile environment. So, you know, the configuration and how young people who are doing peer support are worked into a given organization, it tends to vary a lot from one context to another. So we've been really individualizing our approach to how are we going to work with the broader staff and the teams in that instance. And our AMP Plus efforts are at a somewhat younger stage now, so we're just doing our second implementation. We have a statewide implementation that we're working with and sorting through some of that stuff, and hopefully we'll be developing some more materials to ensure that that organizational support and the team support is really coming along in the way that we hope to see it.
Okay, and Janet, I think we're probably coming near the end here. I've noticed that there's a lot of folks who have excused themselves from the webinar at this point, but one last question that I think is a good one to wrap up with is there any training available on GWAL, or will there be?
Oh, what a perfect question. We must have paid somebody to come up with that one. We just put together earlier this year and tested, so some of you who are out there may have been in on our test, because we used National Wraparound Initiative members as we used them as our guinea pigs. What we call this booster GWAL training, and it's a training that there's a little bit of didactic stuff in the beginning. You know, what does it mean to be have a youth or family-driven conversation, and then we go into some detail of these techniques that we're looking for, how they're done right, how we see them often done in a way that they're kind of self-undermining, which is very interesting. And so we present this didactic material, which includes video clips. We then give people a chance to go on and look at little 5 or 6 minute bits of video, and to actually rate qualitatively, essentially, and comment on what they see going well and not so well. And they push a button and they get feedback that compares what they put to what our expert raters put. So they have several chances to do that. And ultimately we're going to develop that, I think, either into a 3 or 4 module series, a booster training on youth and family driven, and then we want to do another one on strengths. That one will probably not be done for at least a year, the strengths one. And that will be something that will be made available to folks online, and they will be able to, it will include kind of a pre and a post test, so people can actually submit their final rating of a video for scoring, and get, we're hoping also, in addition to their results, also some CEUs for doing the entire module. So our testers, we had user testing, people really liked it, but we got some feedback, so we're going to be changing. So the first one that we did, we're going to break it up into 2, so that's a little bit more manageable content-wise. But people were really enthusiastic, and it's kind of a fun thing to be working on, and we're very gratified to see that people thought that it would be really useful as a booster for wraparound skills.
Great, and I think it's probably a good time to wrap it up here. So I just wanted to thank Janet for all the time and effort that she put into preparing today's presentation, and to everyone that attended. And I also wanted to remind our audience that the webinar slides will be published online shortly at the link that you see on the slide in front of you. And if any of you have any additional questions about AMP and AMP Plus, there's Janet's email. We'll also have those slides available with our collection of past webinars that we hope that you'll be able to see when you follow that link. So this webinar will also be archived with all the resources that we mentioned, and links to them will be available. So we hope you'll be able to join us again for a future webinar, and thank you and goodbye, everyone.